this is Christina Brito for the Daily Mirror. Today we are going to be having a discussion about a very common disease. This disease affects both men and women and is highly treatable, especially if caught early. So I've come to have a chat with Dr. Thathya De Silva, Consultant General Surgeon with a special interest in breast surgery. Hi doctor.
Hi.
Did I get that right?
Yes, you did.
That's a very interesting field that you've chosen.
Yes, it's something that I thought that being a female, I could do a better service to the other females. So that's why I actually chose that.
So let's get straight into the topic at hand, breast cancer.
Yes.
So let's start off by going right down to the basics.
Right.
What exactly is cancer?
Well, cancer is basically a set of cells in the body that has an unregulated growth because of various genes that send signals which allow it to grow rapidly, and this can actually be quite destructive to the body. A lot of things change depending on the type of cancer, but that's the basic idea about a cancer.
Okay, so now since obviously breast surgery is your thing, we're going to be focusing on breast cancer. Suppose I am worried about being a possible patient or like a candidate for breast cancer. What are the things that I need to be aware of? What are the things that make me more likely to have cancer than not?
Right. So this is actually a very common question that a lot of ladies come and ask me. So there are, I'll start with the very obvious ones. First of all, age. So age, the older you get, the higher chance that you have of developing a cancer. So young girls don't have a very high chance, but from 40 and above, with each passing year, generally your risk increases. The next thing is your gender, and I know that there's a concept that this breast cancer, this disease is only something of the females. The reason I'm talking about, yes, right? That's the thing I wanted to stress about. So obviously being a female puts you at a higher risk, but having said that, it's not something that doesn't happen in males. It's important to know that, because then they also should be aware of the signs and symptoms and get themselves checked. Those are the two main things.
So with regards to breast cancer, since both sexes can get it, why is it that women are more perceptible to this as opposed to men?
Mainly two reasons. Of course, women have much more breast tissue than males. The second thing is the hormonal changes. So there's a lot of hormonal impact or effects on the cells of the breast, and also once they develop a cancer, those hormones act, especially estrogen. So obviously males don't have as much estrogen. So because of that, obviously females are more prone to it. So apart from age and sex, then of course family history, that is very important. Reason being, obviously, if your first degree relations, by that I mean your mother, your sisters, or your daughter, or even your brother, if any of them have breast cancer, that puts you obviously at a higher risk of developing breast cancer. It's important to know this because you obviously need to get tested more frequently. Certain families obviously have this gene called the BRCA1 gene and BRCA2 gene that make you more prone to getting breast cancer. They actually have a 50 to 80% chance of developing breast cancer over others. But having said that, not all families who have a person with breast cancer have that gene running through. Most of the time it's much less. But it's an important thing to know, because actually genetic testing is available in Sri Lanka. If required, you can get that done. And then the next thing is hormone replacement therapy. That is something that a lot of ladies tend to use closer to their menopause or after menopause to prevent symptoms of menopause. It obviously has its advantages, but the problem again is it obviously puts you at a higher risk to
putting in
more estrogen into your body. Exactly. Even oral contraceptive pills also has a risk, but it's not as much as it would have with hormone replacement treatment, but still, that is also one of the things that we actually ask patients when they come, whether they are on OCPs. And then, of course, there are other small things that don't have a very direct impact. Like, for example, if a girl attains menarche very early and has menopause much later.
1 second, by
yes.
menarche you mean?
Menarche means they attend age. Okay. Attend age, sorry. So the reason is that lady will be exposed to estrogen for a longer time, and hence the higher possibility of having breast cancer. Having said that, then there are other things like like the weight. Obesity also is, it makes you puts you at higher risk because the fat cells produce estrogen to a certain extent. Alcohol, and excess alcohol actually, and smoking. The reason I wanted to mention these things are because when you divide this into modifiable and non-modifiable things that you can actually change or try to prevent yourself from becoming high risk is you obviously can exercise, good diet, decreasing alcohol, stopping smoking. Hormone replacement treatment depends on, but you can get yourself screened more frequently. These are things that you can change. Age and your sex and family history you can't change. Yes, so it's important that you know that.
What about food?
Food, there is no specific thing that will have a direct impact on breast cancer, but anything that makes you fat or obese obviously will make you put you at higher risk for breast cancer. Yes.
Say I have a suspicion that I could have breast cancer. What are the things that I need to be aware of that's happening within my body that should make me go and get tested?
So basically there are a lot of ways that breast cancer patients can present. The most common one which everyone knows is obviously if you feel a breast lump. I would like to say that most of the time, actually 90% of the time, most of the breast lumps aren't cancerous, but however you need to get it investigated and confirm that it's not benign or malignant. That is something that you need to do. Then there can be nipple changes. Nipple changes could be nipple discharge. We frequently see watery nipple discharge on both sides of the breast. That is most of the time very normal. But if you see blood-stained nipple discharge on one side, you should be conscious about that. You need to seek medical advice. There can be cracking of the nipple or something like an eczema around the nipple, or the nipple can be pulled inside. Those are all the changes that you should be concerned about. Then there can be skin changes. Skin changes mean if the patient comes in a little advanced stage, the cancer cells would have gone a little towards the skin, so it can either pull in the skin, so you'll see a bit of dimpling. There can be breast swelling, so the appearance will look something like a peel of an orange where you get that bumpy appearance. And then of course in very late advanced stages, if someone comes, they can come with big wounds. That's not very commonly seen these days because people are much more aware, but people do come with those presentations. And then of course breast asymmetry. If you notice one breast is normally bigger than the other, which is different, something different than you had before, you need to come and obviously get yourself seen.
Okay, so now say I feel I have to go in for this test. Take me a little bit through what happens during the screening process, because it's a really scary thing and I think a lot of people tend to avoid it because when you hear breast cancer test.
Yes. So actually screening is a completely different entity. If you are coming with a breast lump or any symptoms, then there's a sequence of steps that we generally any doctor would use to come to a diagnosis.
Okay, so let's take this in two parts. Say the first situation is I just want to make sure I'm okay, but I don't have any symptoms. How will that work?
So that is basically breast cancer screening. Generally, breast cancer screening is when we call it that when a person, as you said, comes to us with no symptoms whatsoever, but we basically are trying to detect the cancer as early as we can. This is something that internationally is being done. Most of the other countries have their own guidelines. So basically we in Sri Lanka still don't have a hard and fast guideline. So what we actually do in screening is it's basically the screening mammogram. I'm sure everyone has heard about mammograms. Most of the patients actually come and ask me, do we really have to get a mammogram, because mammogram is not the most comfortable thing. Actually, there is a reason why we always say mammogram over ultrasound scan, which is the other option. So basically at the age of, normally we take 40 as the cutoff. So just to give you an idea, the breast is basically made of mainly glandular tissue and fatty tissue. So there is more glandular tissue in a younger breast as opposed to fatty tissue. So in those ladies, when you do an ultrasound scan, you can get more information as opposed to a mammogram. But with age, when the fatty tissue increases, you basically need to do a mammogram to detect these changes. The reason why it's uncomfortable is because we basically have to put the breast between two plates and basically compress it to a certain degree. I understand that it's not the most comfortable thing, but the reason we need to do it is by doing that we can examine all layers of the breast and then detect even the smallest change. So that is the reason we actually suggest mammogram over ultrasound scan. So basically of screening, what we recommend here is most of the time we advise people to ladies to start at around 40 years of age, and every 2 years to get the screening mammogram done, and of course if there is anything detected in that, then the management would change. So that's basically about screening. Yes.
Okay, so then how does the procedure change supposing I have symptoms and I come to you?
Right. So if you have symptoms, basically any doctor's target is we need to confirm or make sure that it isn't one of the two, whether it's a cancer or not. That's the target. So basically we run through a sequence of things to come to a diagnosis. First of all, we take a detailed history from whoever who comes about all the risk factors I talked about, and then of course the details about the symptoms that they had and so on. Then we do a proper full examination. By full examination, we examine the breasts, check for how many lumps and bumps there are, any skin changes, nipple changes, as I mentioned. We always check the armpits because that is one of the first places there can be spread. And then we also check the chest and abdomen, or tummy, to see whether there again are any signs of spread. So we do a full examination. After that, the next thing is imaging. Imaging is what I taught. Basically, we use the ultrasound or mammograms depending on your age. Above 40, almost always we will suggest a mammogram. They might also do an ultrasound if they need to get more details. And if it's less than 40, I think ultrasound alone would be enough. After that, then if we do see any changes, then we need to know what are the cells that are in that area of change. Okay. That's the main thing. So then we either put a needle or we have got small instruments. We basically get a biopsy. We take some cells and send it for examination, basically to confirm that it is a cancer or not. So basically our treatment thereafter would depend on all of these results. Yes.
That concludes part 1 of this show on breast cancer in collaboration with Asiri Surgical Hospital.